Undinti. Nobody knew the quiet woman in Bay 4 had once called in medevac coordinates under live fire. The nurses on shift that morning thought she was just another exhausted colleague sleeping off a double. She was sitting against the wall in her scrubs, eyes closed, arms loose at her sides. And when the code alarm went off down the hall, her eyes opened before the sound finished. Not startled, ready. Was Mara Callahan. The nurse spoke. She had been a registered nurse at Ridgemont General for 6 years. Trauma wing, nights mostly, occasionally pulled to the ER when they were short. She was the kind of nurse that charge nurses quietly prayed would be on their roster. She didn't complain about assignments. She didn't freeze. Dies innovation. When a patient's pressure dropped without warning at 2 in the morning and the attending was 3 floors away, Callahan was already running the intervention before anyone had finished paging. Much about where that instinct came from. Callahan didn't volunteer it. What her colleagues knew. She was 33. She lived alone in a small rental near the Ridgemont waterfront. She drank her coffee black and brought homemade bannock on long weekends because her grandmother had been Métis, and that was what her grandmother made. She was friendly in a quiet way. She kept to herself in a way that didn't feel cold. Medic. What her colleagues didn't know. She had spent 4 years as a combat medic with the Canadian Forces before nursing school. 2 deployments. One to Kandahar. One that she didn't talk about on the rare nights when someone bought her a drink after a hard shift, and the conversation drifted toward the past. She would listen, nod, redirect. She had a way of making the other person feel like their story was the one worth telling. The morning they fired her, it was raining. She had been expecting it, not hoping for it, not dreading it in the way that kept people up at night, just expecting it, the way you expect weather when you've been watching the sky long enough. Baden. She had filed 11 incident reports in 4 months. Medication dispensing irregularities. A pattern of post-operative complications concentrated in patients covered under a specific private insurer. An attending physician, Dr. Harlan Webb, whose charting didn't match what Callahan had observed at bedside. She had documented everything. Dates, times, patient ID numbers, discrepancies noted in plain language. She had submitted each report through the proper channel to the risk management office as required. The reports had not gone anywhere. Or rather, they had gone somewhere, just not where they were supposed to go. Out later that the risk management director, a man named Gerald Sproat, had been forwarding them directly to the hospital's chief operating officer, Diane Cheng. And Cheng had been filing them in a folder on her desktop that she apparently thought of as a problem to be managed rather than a record to be acted on. Morning, sitting in Cheng's office with its view of the gray harbor and the framed mission statement on the wall. Compassion. Integrity. Excellence. Callahan didn't know any of that yet. Immediateless. All she knew was that Cheng was telling her, in the measured tone of someone who had rehearsed this, that her employment was being terminated effective immediately. Conduct unbecoming. Failure to work collaboratively within the care team. A pattern of behavior that had created a hostile environment for colleagues. Callahan sat across the desk and kept her hands still in her lap. In a different context. She had learned it when moving meant drawing fire. She had carried that lesson into every room she'd walked into since. Boardrooms, briefings, conversations, where someone was trying to throw her off balance. You breathe. You let them finish. You don't give them your reaction. Because your reaction is the one thing you actually own. Do you have anything you'd like to say? Cheng asked. I'd like copies of the incident reports. I submitted, Callahan said. All 11 of them. There was a pause. A brief recalibration behind Cheng's eyes. Internal documents. Talk. Documents I authored. I'd like copies. I didn't get them that day. But she had already made her own copies, months earlier, when she had first understood that the proper channel might not be as clean as it was supposed to be. She had printed them at the public library 3 blocks from the hospital. They were in a waterproof folder in her apartment, tucked between her nursing textbooks and a photograph of her grandmother. It in her badge. She walked out through the main entrance, not the staff exit. The main entrance, past the information desk and the mural of autumn trees that the hospital's foundation had commissioned to make the lobby feel warm. It was still raining. She stood outside for a moment and let it hit her face. Then she went home. Losing a job that had been the structure of your life are strange in a specific way. Callahan had been through disorientation before. The particular vertigo of coming home from a deployment and finding that the rhythms of civilian life felt arbitrary and thin. She knew how to move through it. You make the bed, you eat, you go outside, you give yourself tasks with clear endpoints. Needed insurance. She filed for employment insurance. She updated her nursing registration. She contacted the College of Nurses of Ontario. Ridgemont was just across the provincial border from Ontario, technically, and her registration crossed jurisdictions to understand what protections existed. For nurses who reported concerns and were subsequently terminated, the answer was more complicated than it should have been. Idle. But she was careful about what she did next, because she understood by then that she was dealing with something that had weight behind it. Institutions that fired whistleblowers rarely did so carelessly. There would be paperwork. There would be a narrative. There would be people whose job it was to make her look like the problem. Listened. She was right about all of that. A former colleague, Priya Mehta, texted her 3 weeks after the termination. Heads up. They're saying you had a mental health episode, that you were erratic. People are being careful about what they say to you. Come on, routine. Callahan read the message twice. Then she put the phone down and looked at the ceiling for a while. Documented everything. That was the thing about the combat medic part of her past that never left. Not the adrenaline, not the memories, but the training around documentation. Soldier spoke. In a forward operating environment, records were the difference between a confirmed casualty and a missing person. Records were how you proved what happened when no one was left to testify. She had internalized that completely, and she had carried it into nursing without even meaning to. She had her copies. She had dates. She had patient record numbers that could be cross-referenced. She had Dr. Webb's name attached to specific anomalies on specific dates. What she didn't have yet was someone with the authority to do something about it. She started researching. Quietly, methodically, the same way she had studied triage protocols in field medicine and later pharmacology, because that was how she learned things, in a source and working through it until she understood the structure. She read about healthcare fraud in Canada. She read about the Office of the Superintendent of Financial Institutions. In Mincer, she read about provincial health regulators and their complaint processes. Investigative journalists. She'd about investigative journalists who had covered hospital billing irregularities. Another came. She was 3 weeks into this when the knock came. Then a soldier spoke. It was a Tuesday morning. She was at her kitchen table with her laptop and a second cup of coffee when she heard it. Not an urgent knock, not aggressive, but deliberate. The kind of knock that said, "We know you're in there and we're not leaving." She went to the door. Come on. A woman, mid-40s, in a gray blazer with close-cropped hair and the posture of someone who had spent years in uniform and never quite left it behind. A man, younger, in a dark jacket, holding nothing. Neither of them looked like police. But they weren't pretending to be something comfortable either. "Man," the woman said, "Mrs. Callahan. My name is Inspector Diane Ford. I'm with the RCMP's Integrated Financial Crime Unit. This is my colleague, Agent Thierry Leclerc, from the Health Canada Fraud Investigation Branch." She paused, brief and precise. "We'd like to speak with you about Ridgemont General Hospital." Ramon, Callahan looked at them for a moment. "And more coffee," she said. "Mabe." They sat at her kitchen table, the same table where she had been building her own quiet case for weeks. And Ford laid out, in careful, measured language, the shape of what they had been investigating for 14 months. What they told her took a few minutes to fully absorb. The fraud at Ridgemont General was not about individual doctors cutting corners. It was a billing scheme, systematic and coordinated, running across 3 departments and connecting to a network of medical supply companies that were billing for equipment and procedures that never been ordered, never delivered, never performed. The insurance payouts had been flowing through a series of numbered corporations to accounts in 3 provinces. When a soldier spoke, the total estimated figure was in the range of $12 million over 4 years. Dr. Webb was one of 4 physicians involved. Cheng had known. Sproat had known. There were 2 people on the hospital board who had known. Omar Ndidi said, "We've had the structure for a while," Ford said. "What we've been missing is patient-level documentation from inside the care teams. The kind that would establish that specific procedures were billed that never happened. That would require someone who was present at bedside, who had direct knowledge." She looked at Callahan. "Your incident reports," Callahan said. "Your incident reports," Ford confirmed. "We obtained copies through a warrant, but Sproat's office shredded the originals 6 days after your termination. What exists in the hospital system has been partially altered. We know that from metadata." She paused. "We were hoping you might have retained your own copies." Zigdon. Callahan got up. She went to the shelf between her nursing textbooks and the photograph of her grandmother. She came back with a waterproof folder and set it on the table. And then Ford looked at it. Then she looked at Callahan. "Moss, you made copies." "The library," Callahan said. "March 14th. 3 blocks north of the hospital. I used the printer by the window." I wrote something down. Ford was quiet for a moment, in the way of someone recalculating. "Mrs. Callahan," she said, "I want to be straightforward with you. We've been watching Ridgemont for over a year. We had investigators. We had financial analysis. We had the corporate structure mapped. What we didn't have was a witness from inside the clinical environment who could speak to specific patient encounters." She stopped. "You built a parallel case from the bedside, without knowing what we were doing." "I knew something was wrong," Callahan said. "I documented it. That's what you do when something is wrong." In a piece, there was a silence. In a bane. Then Ford said, "Before we go any further, your background, the Canadian Forces, your service record." "Already know it," Callahan said. "Events?" "We do. I wanted you to know that we know." A pause. "It's part of why we came to you directly rather than going through a lawyer first. We thought you'd understand the kind of conversation we were asking you to have." Callahan understood. "You learned, in the forces, that there were conversations that had to happen before the paperwork. Conversations where people decided whether to trust each other. Where you looked at the person across from you and made a judgment about who they were, and whether the thing you were about to do together was going to hold under pressure." "Come on," in a felt distant Fert dared. "Give me what you need," she said. Consent. What they needed was not simple, and it was not fast. Callahan worked with Ford's team in a process that felt, in its rhythms and its intensity, more familiar than it probably should have. Secure briefings in a nondescript building off Robson Street. Review of patient records under a temporary access authorization. Obtained through the Provincial Health Minister's office. Meet Dismoon. Preparation of a formal witness statement that ran to 43 pages and took 4 sessions to complete. She did not embellish, she did not hedge, and she had learned in the forces that a good report was not about making things sound dramatic. It was about being so precise that the facts did the work. She applied that here. Patient ID, date, attending physician, charted procedure, what she had observed, the discrepancy. 43 pages of that, documented in the same plain language she had used in the incident reports. Spoke. The investigators had told her at the outset that she might find the process difficult, that reviewing the records might bring up things she hadn't expected. They were not wrong. There were patients she remembered clearly. A man in his 70s who had been on her watch for 3 nights running and who had thanked her. The morning he was discharged, who she now knew had been billed for a surgical implant he had never received. A woman who had come in with her daughter and who had been frightened and who Callahan had sat with for 20 minutes after her shift technically ended. Because the daughter had needed a moment to speak with the attending, and no one should sit frightened and alone. She reviewed those records, and she kept her face still, and she gave the investigators what they needed. Priya Mehta agreed to give a corroborating statement. 2 other former staff members did as well, once it became clear that the investigation was serious and that they would not be left exposed. The arrests were made on a Thursday morning in November. Callahan was not there for them. She was at home, in the same kitchen, with coffee, when Forday texted her, "It's done." 6 arrests. Webb, Cheng, Sproat, 2 board members, 1 supply company director. Press release going out at 10. Message for a while. She looked at the Sans-Emilion. The window, the harbor was flat and gray, and there were gulls moving over it in long, slow arcs. She had grown up 2 hours north of here, near Georgian Bay, and the water had always looked like this to her in November. Not threatening, just honest. This is what the world is when no one is performing anything for it. A man in his 70s, she thought. About the man in his 70s who had thanked her the morning he was discharged. She thought about her grandmother who had said once that you do the right thing not because someone is watching, but because you are watching. Because you have to live inside yourself. She had been living inside herself for 6 years in that hospital. She had seen something wrong, and she had documented it, and she had been fired for it. And she had kept going anyway. Not because she was heroic, not because she had some particular courage that other people lacked, but because there was no version of herself that could have done otherwise. That was what the forces had given her, more than the field medicine and the medevac coordinates, and the ability to stay still under pressure. It had given her a clear understanding of what it cost to abandon your own standards. She had seen that cost in specific and irreversible terms, and she had no interest in paying it. Then a soldier spoke. The story became public through a combination of the RCMP press release and a piece by an investigative journalist at the Globe and Mail who had been tracking healthcare billing fraud across 3 provinces, and who recognized Ridgemont General as a piece of a larger pattern she had been documenting for 2 years. And so Callahan's name was mentioned. Her nursing background was mentioned. Her military service was mentioned. Calls she didn't expect. She got calls organization out of Ottawa. A nurses' union rep from British Columbia who wanted to know if she'd speak at their annual conference. A woman from Monmouth, Ontario, who had lost her husband to a complication at a for-profit clinic and who had been trying for 3 years to get someone to listen. Back first. The Not-Sargazin written for spoke. 6 months after the arrests, Ridgemont General came to Callahan with a settlement offer and a formal written apology. The letter used the phrase regrettable circumstances twice, and the phrase we value the contributions of all our staff once, which told her something about who had written it. She accepted the settlement. She did not return to Ridgemont. Agnes already accepted a position at a community health center in Sudbury, 40 minutes from where she had grown up. The center served a mixed population, mining families, remote communities, a significant indigenous patient population that the larger regional hospitals had historically underserved. The work was different. Slower in some ways, more complicated in others. On her first day, the clinic's director, a soft-spoken family physician named Dr. Amara Osei, walked her through the intake procedures and the patient flow and the particular challenges of maintaining continuity of care across distances that most urban healthcare administrators didn't factor into their models. Ghalim Hazmi, then a soldier, spoke. At the end of the tour, he stopped and looked at her with the directness of someone who had been doing this long enough to not waste time. "What about what happened at Ridgemont?" he said. "I'm not hiring you because of that. I'm hiring you because your references said you were the kind of nurse who stays." He paused. "We need people who stay." Sprose. She thought about what staying had actually looked like. The incident reports, the library printer, the waterproof folder on the shelf, the 43-page statement. The man in his 70s, the woman who had been frightened. "I'll stay," she said. In matter, she meant it in every way that mattered. I keep thinking about the library printer, 3 blocks north of the hospital, by the window. Mara Callahan standing there on a March afternoon, printing 11 incident reports that no one had asked her to keep, that no one even knew she was making copies of, because she understood, in some quiet and unspoken way, that the proper channel might not hold. Not cynicism. That's clarity. And I think there's a difference worth sitting with. Most about what Callahan did isn't the dramatic part. Not the RCMP showing up at her door, not the arrests, not the 43-page statement. It's the months in between, when she was unemployed and quietly being described as unstable by the institution that had fired her, and she just kept going. Made the bed. Went outside. Researched healthcare fraud law at her kitchen table. Morn from Monmouth called back the woman from Monmouth, whose husband had died, and who had been trying to get someone to listen for 3 years. She didn't keep going because she was certain it would work out. She kept going because she couldn't find a version of herself that would stop. That a lot when I think about what it actually means to have integrity, not as a word on a hospital mission statement, but as something you carry in how you move through a room. And you again. Callahan had watched what happened when people abandoned their own standards in specific and irreversible situations. Gerber spoke. She had a clear-eyed understanding of that cost that most of us spend our whole lives trying to avoid acquiring. And it made her, in some essential way, unbluffable. Amena came in. You can fire someone like that. You cannot make them into something they aren't. Unmend. The intelligence part of her story gets overlooked because the moral part is so clean. But think about what she actually did. She identified a pattern from bedside observations alone, documented it in precise language, cross-referenced patient records, understood the difference between a reporting channel that was merely slow and one that had been compromised. Tivir spoke, and then quietly built a parallel case without knowing that federal investigators were building their own. She didn't have authority or resources. She had rigor. She had the discipline to treat her own observations as evidence worth preserving. The willingness to act rightly and the capacity to think clearly is most of the story. But there's a third thing, and it's the one that doesn't get discussed enough. It's endurance, not the dramatic kind, the ordinary, unglamorous kind that looks like eating breakfast and making a list and doing the next small thing when you have no idea whether any of it is going to matter. Regiment soldiers. Callahan had all three: the ethical backbone to document what she saw, the analytical rigor to document it in a way that held up under federal scrutiny, and the steadiness to keep going through the weeks when she was just a fired nurse with a waterproof folder and no guarantee of anything. Dr. Sosi told her they needed people who stay. I think that's the whole of it, really. The world has enough people who do the right thing once, when the stakes are clear and the outcome looks promising. What it needs, what it has always needed, is people who stay.